Yeah, you can.
I didn't know.
Okay, there we go.
All right. On the right, this is the right common carotid artery, and then beside it should be the right internal jugular vein and the right external jugular vein, and there's the right, here it is, right subclavian vein, and that would be also in here the right internal thoracic vein. But anyway, these are all coming together and forming the right brachiocephalic vein, and over here is the left side, so there's the common carotid artery, the internal jugular vein, the external jugular vein, and the subclavian vein, and all those come together and form just right here, they just join up. That would be the left brachiocephalic vein, and the right and left brachiocephalic veins join to form the superior vena cava right there. All right, which enters into the right atrium of the heart, along with the inferior vena cava here entering into the right atrium. Now, we have the two atria, right and left, and in between the two, there's the pulmonary trunk. And right behind the pulmonary trunk is where the arch of the aorta would be located. And so here we have the first branch coming off of it. That's the brachiocephalic trunk, and that's going to give rise to both right and left common carotid arteries and the right subclavian artery. And then the second branch that's coming off, you can see it right here, that is the left subclavian artery, which is coming up here and starting out toward the left foreleg, okay? And in fact, you can actually see here it is. There's the subclavian artery. There is the subclavian vein that's coming out of there as well. And if we can continue on down in here, then when it enters, and you can pick on this a little bit more later, and it just continues on, becomes axillary, axillary artery and vein. Now, this is the umbilical vein. It's been cut. That's fine. Now let's see here if we can get this moved over. Okay, right against the vertebral column. That is the thoracic aorta, and then it isn't as well injected in this one as some others. Some other people have more of a picture book of example, but this vein right here, that's called the hemiazygous vein, okay? And it's draining primarily from the left side of the back and, the area between the ribs as well. And then in between the ribs, there are those intercostal arteries and veins, okay?
In between them?
In between. See, they just look like little lines here, little pink lines, okay? All right, now, if we can get below the diaphragm and into the peritoneum, we got a bunch of stuff in here we have to get rid of. Okay, well, I'll tell you what. Take it to the sink and dump it. Just turn it upside down.
I wasn't recording.
Okay, that's what I did. All right, now see, that's inferior vena cava there.
Where?
Right here. See, it's closer to the anterior side, whereas the aorta is toward the back, more
and
dorsal.
And those pink things that are right there, that's what you're talking about was the intercostal vein
right.
thing?
Mm-hmm. Now, let's see, one other little thing, too. Let's see if we can find, yes. Now, there's a big vessel down in here called the hepatic portal vein, and it's right in here, okay? And you can probably see it right here. That's it, heads for the liver. And then if we get it off over to the side, there is the inferior vena cava, okay? So you see, it's kind of like the inferior vena cava is more toward the back, and this one's slightly above it toward the ventral side, okay? Mm-hmm. All right, now, All right, let's see what we can do here. Get some of this picked out of the way. Okay, now, that blue vessel there, that would be the left renal vein, and it's going over here to, I think we need a towel, to the inferior vena cava, okay? Then the aorta is right along here, okay? And if we pick around here some more, you can see where the renal artery comes off and heads toward the left kidney. Ah, there it is. Oh, well, let's see. Mop out some of this stuff. It's not very big, but that little pink vessel right there, that would be the left renal artery, okay? So there's the artery, there's the vein, okay? And there, of course, obviously the kidney. And then this kind of collapsed muscular tube, that's the ureter that goes off of the bladder, which is right here, okay? Between the two umbilical arteries, left and right. Okay, now let's see if we can come back up here and find some other goodies. All right, now we ought to be able to find
that's why I want to fuck around with those.
Okay, the first branch coming off the aorta is the celiac trunk, and it ought to be like right here. Here it is, okay? There's the celiac trunk, okay? Then the next one back should be the superior mesenteric artery. Okay, let's see here. It ought to be right in here. Okay, so we have the celiac trunk and then the superior mesenteric artery. Come on, just tear a bit. And you can see, okay, here it is. Okay, that should be it right there. It's hard to get it totally isolated. And then you have, of course, the renal one. And let's see, this is a male. Let's see if we can find where the testicular artery comes off. Okay, it's down here. All right, you see right here. That little pink vessel there coming off the aorta, that is the testicular artery, and there'd be a vein right beside it. Now, we need to cut a little bit more. Yeah. Well, move it out of the way. You don't want juice on it. All right, now, we're not ready for this yet, but anyway, like the ductus deferens coming up out of the scrotum and all that stuff, we'll get to that later. Now, what we want to see here, of course, is the veins and arteries.
There you go.
So, there is an umbilical artery, which is a branch of the internal iliac artery, and then that would be probably the common iliac. Okay, that's the testicular one there. And we just need to pick around here a bit more. see where the end of the aorta is and where it branches.
I can just keep going.
Okay.
There's that new phone next door on the wall right there. Come on.
Get a new case.
Okay. Over here. I don't want to tear that. All right. You can see here the umbilical artery, all right? Then you see this branch over here to the side. There's the iliac artery and vein right beside it. And then we come down toward the leg. I think that's a minor one we can get rid of.
If it's too big to put in a message, I'll just write down my number and then I'll write down my email. Okay. Then it will put it. Yeah.
Well, I think we'll just do this.
Intestines have really dried out. We didn't get that far.
Okay, so like this would be the femorals coming down into the leg, and there's an artery and a vein, and then there's this little branch here that comes down the pelvic area. That would be the deep femoral artery and vein, okay? All right, so there you go. So we have femorals, iliacs, okay? And so the external iliac and then internal iliac. And then see how all this comes together here, the aorta. And the veins are coming together here to form the beginning of the inferior vena cava, which is kind of like right beside it, okay? And then, if you spread out the guts, there are the mesenteries. And the little vessels that are in here, those are the mesenteric arteries and veins that go out to the intestine. And those little black things, those are lymph nodes. More on those later.
That's all?
Probably. That's the bulk of it.
Oh.